Hi, hello everyone, this is your nursing student Brian, and for today's video, we are going to perform the physical assessment of the neurologic system. Cranial nerve 1 up to cranial nerve 12, okay? Prior to performing the procedure, we need first to introduce ourselves and verify our client's identity, okay? Hi ma'am, good afternoon. I will be your nursing student Brian. May I know your name please?
Adelina Petronio.
Your birthday?
March 30, 1960.
So you're from Burawen, am I correct?
Yes.
Alright. So after that, you need to perform hand hygiene. In performing hand hygiene, this is to prevent yourself from the transmission of viruses, diseases, or bacteria, okay? After that, you need to provide clients privacy, okay? You need to provide clients privacy by closing the door, the window, and using curtains, okay? To provide clients privacy. First procedure we have in neurologic system is we need to perform the test for cranial nerve 1, which is the olfactory, okay? In this procedure, we need to ask our client to clear the nose to remove any mucus, okay? Then to close eyes, upload one nostril, and identify scented object that we are holding, such as soap, coffee, and vanilla. And we need to repeat the process or procedure for the other nostril, okay? Ma'am, I want you to close your eyes, upload one nostril, alright? And I want you to smell and tell me what object is this or scented object is this, okay?
Yes.
What is this?
Banana.
Okay, very good. Can you upload the other one while closing your eyes, okay? What is this?
Garlic.
Alright, very good. So, clients correctly identifies scent presented into each nostril. This means my client's olfactory is well functioning, no indication of neurologic anosmia. Next procedure we have is we need to test cranial nerve 2, which is the optic, okay? Ma'am, in this procedure, I'm going to perform the Snellen chart to assess your vision in each eye, okay? I am going to use the Snellen chart. Would it be okay?
Okay.
Alright, I'm going to stay 2 feet away from you while holding this Snellen chart. And I want you to read, okay? I want you to read
Yes.
this letter, okay?
Okay.
Alright. I'm going to stay 2 feet away from you, okay?
Okay.
What number can you read, ma'am?
Number 8.
Okay, very good.
D, E, F, P, O, T, E, C.
Alright, wow, congratulations. You have a 20/20 vision. Alright, so based on the performance of my client, she has a 20/20 vision, which means normal, okay? No abnormal findings, including difficulty in reading the Snellen chart, missing letters, and squinting. Everything is fine, everything is normal. Next procedure we have in assessing or for the test of cranial nerve 2 is we need to assess the visual fields of each eye by confrontation, okay? Ma'am, I want you to cover your left eye. And while looking at my eye, and tell me what number I project, okay?
Okay. 1,
Okay,
2,
very good. I want you to cover your right eye. Alright?
three,
Another one.
2,
Okay. So, client has a full visual field. No loss of visual fields may be seen in a retinal damage or detachment that has lesion of the optic nerve or lesion with the parietal cortex. Next procedure we have is we need to assess or test the cranial nerve 3, which is the oculomotor, cranial nerve 4, the trochlear, cranial nerve 6, the abducen nerve. Okay? First thing we're gonna do is we need to assess the extraocular movement of the eyes. Okay? If nystagmus is noted, determine the direction of the fast and slow phases of movement. Okay? Ma'am, I want you to focus in this object or this pen while I am performing the 6 cardinal field of gaze. Okay?
Okay.
I want you to focus on this, okay?
Okay.
As I move the pen up and down, okay?
Okay.
Alright. Okay. Don't move your head. Okay, very good. Alright, other one. Okay, very good. So, my client's eye moves in a smooth, coordinated motion in all direction, which is the 6 cardinal fields of gaze. Okay, no indication of nystagmus or involuntary shaking of the eyes, paralytic strabismus. Next is we are going to test the pupillary reaction to light. So we are going to use a pin light and close the room's light. Can you turn off the lights, please? Thank you. So I'm going to use a pin light and we're going to test the reaction. Okay, ma'am, can you look at me? Okay. Okay, constricted. Alright. Turn the lights on, please. So as I perform the procedure, the pupils reacted to the light, which is constriction, which is absolutely, it is a normal reaction. Next procedure is we are going to test for accommodation of the pupil. So in this procedure, we are going to ask our client to focus on our finger or this pencil. And we are going to remain, and we need our patient to remain focused on it as we move this object closer to his eyes, okay? I'm going to test your pupillary accommodation, ma'am. So you need to focus in this object as I move closer this to your eyes, okay? Did you got it?
Yes.
Okay. So stay focused on here. Alright. Okay, so as I move closer the object, the pupils constricted and the eyes is converging, which is very much normal. Next is we are going to assess the cranial nerve 5 trigeminal, okay? The trigeminal nerve. In this procedure, we are going to test the motor function, okay? So we need to ask our client to clench their teeth while we are palpating the temporal and masseter muscles for contraction. Okay? Ma'am, is it okay to touch you?
Okay.
Okay, I'm going to put my hands and I want you to open your mouth. Okay? Another one, please. Clench your teeth for me, alright? Alright, so based on the performance of my client, the temporal and masseter muscle contract bilaterally, okay? No unilateral muscles weakness that may indicate lesion or cranial nerve lesion on the cranial nerve 5, which is the trigeminal nerve. Next procedure we have is we need to test the cranial nerve 7 or the facial nerve, okay? So in this procedure, we are going to perform the test for motor function, okay? So therefore, we need to ask our client to smile frown, wrinkles the forehead, show the teeth, puff out the cheeks, and purse the lips, raise the eyebrows, and close the eyes tightly against the resistance. Okay? Alright, ma'am. I want you to smile for me. Okay, can you please show your teeth for me? Okay, very good. Can you close your eyes for me tightly against resistance? Okay, very good. Can you raise your eyebrows? Again. Okay, very good. Can you wrinkle your foreheads for me? Okay, very good. Can you purse your lips for me? Pop out your cheeks. Okay, very good. Can you frown for me? Alright. So, my client can smile, frown, wrinkles the forehead, show the teeth, puff out the cheeks, purse the lips, raise eyebrows, and close his eyes against resistance. Movement are symmetric, okay? No indication of Bell's palsy and stroke. Next procedure we have is we need to test the cranial nerve 8, which is the vestibulocochlear, okay? In this procedure, we are going to test the client's hearing ability in each area and perform the whisper test to assess the cochlear or auditory canal or the auditory components of the cranial nerve 8. Okay? Ma'am, I'm going to perform the whisper test. Is it okay?
Okay.
I'm going to tell you, or I'm going to whisper a 2-syllable word, and I want you to tell me what I project or what I am trying to say or what I am trying to whisper. Okay?
Okay.
Alright. I'm going to upload my whispering on this side, okay? Basketball.
Basketball.
What is it again?
Basketball.
Very good. Another one.
Brian.
Wow, that's great. It's Brian. You're correct, ma'am. Okay, so my client can hear whispered words from 1 to 2 feet, and it is very much normal. No indication of sensory neural hearing loss. Next procedure we have is we need to test the cranial nerve 9, which is the glossopharyngeal nerve, and the cranial nerve 10, with the vagus nerve. Okay, in this procedure we are going to test the motor function. Okay, we are going to ask our client to open the mouth wide and say the word ah while you use the tongue depressor on the client's thumb. Okay, ma'am, I want you to open your mouth wide, and I'm going to insert this tongue depressor on your tongue. Okay, I want you to say ah.
Ah.
Another one, please.
Ah.
Very good. Okay. The uvula and soft palate rise bilaterally and symmetrically on phonation. Okay. Next procedure we have is we need to test the gag reflex by touching the posterior pharynx with the tongue depressor. Okay. I want you to open your mouth, ma'am, for me. Okay. That's great. So, gag reflex and tap, no indication of volition on the cranial nerve 9 and cranial nerve 10, okay? Which is the vagus Next nerve. Procedure we have is we need to check the client's ability to swallow by giving the clients a drink of water, okay? We need also to note the client's voice quality. Okay? Ma'am, I have here a glass of water. I want you to sip a little amount of this water as I observe the movement of your okay. Another one, please. The movement of your okay. So, based on the performance of my client, based on the assessment, client swallows without difficulty, okay? No hornies noted, no indication of dysphagia or any neurological disorder. Next procedure we have is we need to test the cranial nerve 11, which is the spinal accessory nerve, okay? In this procedure, we need to ask our client to shrug their shoulder against the resistance to assess the trapezius muscle, okay? Mom, I'm going to touch you. Is it okay?
Okay.
Alright. I want you to shrug your muscle. Okay, another one, please. Another one. Another one. Another one, please. Okay, thank you. Okay, I want you to move your head on the left. On the left. Okay. On the right. Okay. Another one. Very good. It's strong. Okay. There is a symmetric strong contraction of the trapezius muscles and no indication of paralysis or muscle weakness due to neck injury or torticollis. Next procedure we have is we need to test the cranial nerve 12, which is the hypoglossal nerve, okay? So in this procedure, we need to assess the strength and mobility of the thumb, and we need to ask our client to protrude the thumb and move it to each side against resistance of the thumb depressor. And then we need to put it back into the mouth again, okay? To its normal position. Mom, I want you to open and protrude your thumb for me. Okay? I want you to move your thumb, okay, against resistance of the thumb depressor. Alright, it is strong. Other one. Alright. So client's thumb movement is symmetric. It is smooth and bilateral strength is apparent. Okay? No indication of fasciculation and atrophy of the thumb. Everything is fine. Everything is normal on my client's body.